Now I want to talk about something really interesting, and that is gluten. Well, you see, gluten, it's a molecule, just like all the other molecules that we eat. But some people have this thing called celiac disease, whereas others are simply sensitive to gluten or intolerant. It is not that common among doctors to confuse these two conditions, but patients do confuse them very often. And they often come up with questions: what am I allowed to eat? What am I not allowed to eat? Of course, there are ways to see if the doctor has misdiagnosed this condition, and in reality, the patient does not have celiac disease, but rather simply gluten sensitivity. One important barrier in figuring out which one of these two conditions the patient has is that both of these conditions are very common. The sensitivity is, it has the prevalence of around 5%, whereas the celiac disease has the prevalence of around 1%, right? So because of these numbers, it is simply easier to assume that the patient most likely has gluten sensitivity. And that's where mistakes can happen. That is why it is not smart to diagnose patients with gluten sensitivity without proper diagnostics. It could be that they're here in these 1% who actually do have the celiac disease. It often comes as a surprise to many patients that if they have this gluten sensitivity, right, they don't have to avoid gluten at all costs and completely, but they can just reduce the amount of gluten intake, and that will reduce their symptoms as well. So, what are these symptoms actually? And how can we differentiate between sensitivity and celiac disease? You see, let's start with gluten sensitivity. So gluten sensitivity, it comes with bloating, right? And also pain in the abdomen, right? So bloating and pain. But if we look at the celiac disease over here, which is a little bit less common, right? Well, it also comes with bloating and pain. So how can we tell these conditions apart? If we look at the symptoms, right, they do come with similar symptoms, but there are additional symptoms, and these symptoms, they don't come always at the same time. They have a different way, the way they appear. So for example, if a patient additionally has a diarrhea, it can happen that the patient has the celiac disease. Most commonly, patients with celiac disease also have diarrhea. But if the symptoms start right after a meal, well then that is indicating that the patient is suffering from sensitivity. So let's say I eat something, it goes down into my stomach and then into my intestines, and then eventually the symptoms start. Well, I'm most likely sensitive to gluten. But ultimately, with these conditions, one can never appropriately get a diagnosis without biopsy, right? Biopsy is the final tool that gives us a diagnosis. In a histological examination of patient with gluten sensitivity, we can actually find pretty much normal histology. That means we will not see any pathological changes in the cells or the structure of the tissue, whereas patient with this so-called celiac disease will have pathological changes upon examination. And that is the real way to diagnose a patient with one of these conditions. There are other symptoms which are also indicators of celiac disease. Well, and these actually include malnutrition, anemia. For example, you can notice that the patient has anemia by just looking at his skin, and if the skin is pale or if the lips are pale, well, then you could assume that the patient has anemia. Of course, it requires additional tests and examinations, but patients with celiac disease also suffer from osteoporosis or infertility. Additionally, for example, skin inflammation can be present in many patients. So if you have more questions about these conditions, well, then you can go to, wait a minute. If you're a doctor and you want to make videos like these, then go to Symptomsky.com. But if you're a patient and you have questions about gluten sensitivity, well, then you can actually go to symptomsky.com/help/gluten-sensitivity. Okay, symptomsky.com/help/gluten-sensitivity. Both doctors and patients and audience can subscribe to this channel and like our video. So both of these things, subscribe to our channel and like our video. Or you could also share it additionally. So these three things, subscribe, like, and share. It's going to help us a lot. A lot of people suffer from these symptoms. They don't really know what they have. They don't really know who to talk to. And, there are millions of diseases. So we have identified 50,000 of them in humans, but who knows how many more diseases there are. So doctors cannot know everything. So if you know somebody who has these symptoms, then you can share it, and maybe they're going to figure it out eventually. So you can help us help other people.